Okay, so we will get started. And thank you all for being with us on this wonderful day. Uh, the blessing of a light dusting of snow that we got this morning on our event for Black History Month. And we'll just get started here slowly as people file in. The theme of our talk here today is stories from the Frontline. We are celebrating Black healthcare professionals, and we have a wonderful panel for you and a great discussion that I know is going to happen afterwards in the Q&A, so we're looking forward to all of that. The theme for Black History Month in Canada this year is honoring Black brilliance across generations, from nation builders to tomorrow's visionaries. So really looking ahead to how Black people can continue to contribute to the daily life in every way of Canadian society. And certainly that is the case here at PHSA. So I want to start us off in a good way with a land acknowledgement, and acknowledging that we are all calling in from different places in this beautiful province, and are thankful for the lands we are on. I am calling in from my home on Musqueam, Squamish, and Tsleil-Waututh Nations territory, the same territory that PHSA head office is on. And with gratitude, I am a grateful guest, and I will give you my little background later, but wanted to read a lovely declaration that I found from the Tsleil-Waututh First Nations, meaning the people of the inlet. And it's just a little declaration. It reads as a poem, and it's very beautiful. And it says, "Our people traveled far and wide on our traditional territory. They paddled our waters and climbed our mountains. They understood the richness that our traditional territory held. And in understanding this, they knew our land. Our ancestors were responsible for the rivers, streams, beaches, and forests of the traditional territory. Our people knew our land well because it was for the benefit of everyone." And that really stuck out for me because we are all invited here or uninvited to share these lands and to do so in a good way. Because this is Black History Month, and there is a connection between people that were brought here, that were stolen and brought here to work on stolen lands. I just wanted to acknowledge that connection. And that includes Canada, where African descendants were enslaved for 200 years, longer than Canada was even a country, has been a country. And through that, in being transplanted, wherever they were, they also had relationships and encounters with Indigenous populations. They formed alliances. They mixed with them and formed even a culture all into their own, where there's all over the world many people of Afro-Indigenous descent. And so this is a very long road and partnership of shared solidarity and struggle. So I welcome you all to this space in that spirit. Starting us off, I'm just going to introduce myself quickly, and then we will get started with our keynote, and Melissa Crump. So my name is Kathleen Johnson. I'm a senior advisor on the DEI team, and I'm a mother of 5. I'm a cisgendered woman with disabilities of Caribbean background. I was born and raised in Calgary, Alberta, and Toronto is my second hometown. I moved to BC in 2022 to start at the provincial legislature in BC, where I was a ministerial advisor. And I have a BA in sociology and cultural anthropology from Carleton, DEI certificate from Cornell U, and other fun diplomas and certificates in coaching. And I am an author of a book, Thinking Outside the Boardroom, Creative Solutions in Diversity, Equity, Inclusion, and Anti-Racism, where I explore creativity in corporate spaces and host a podcast. You can check it out later. Put a link in the chat if you're interested. And I contribute to a magazine as a DEI expert. That's a little bit about myself. And our other moderator, Stephanie, will tell you about herself when she gets her time. And I just wanted to start off introducing our esteemed Executive Director of Diversity, Equity, and Inclusion, Melissa Crump. She has over 20 years of healthcare experience as a registered nurse with multiple care settings such as youth corrections, youth mental health, gynecology, subacute and acute medicine, as well as infection control and prevention. As an advanced practice nurse leader, Melissa works with leadership and organizational development, where her passion for improving patient and provider experience is actualized within the healthcare setting. Melissa's passion for change, engagement, and complexity science has allowed her to facilitate, consult, and share her knowledge on healthcare topics, as well as those that are meaningful to the Black community. And with that, I hand it over to Melissa.
Yeah, thanks for that, Kathleen, and good afternoon, everybody. It's a pleasure to get to welcome you all and say Happy Black History Month. For me, it's a whole year. It's every day, but we do honor it here in Canada for the month of February. It's also an honor for me to get to lead the DI program here at PHSA. And they gave me a few questions to answer. So hopefully I will sum it up in the brief 10 minutes they gave me, maybe 6 if I'm really, really good. When I think about Black History Month, it's a unique time. Like I said, for me, it goes over the whole entire year, not just a month. But it allows me to pause and reflect upon whose shoulders I'm standing on to be here with you today. I was born on the lands of the Musqueam, Squamish, and Tsleil-Waututh people, but I have a very complicated and deep roots on the lands of the Kalinago and Tano people of Wadadli, and that is colonially known as Antigua. So if you've all been on a cruise or you've heard about it, it's a very beautiful island with 365 beaches, one for every day of the year. But if you know a little bit about history, Kathleen has already alluded to it. We are stolen people who live on stolen land. And so I straddled two very distinct worlds. I straddled the world of where I know sort of where some of my people are from, which is the island of Wadadli, and then I straddle here in Canada. But regardless, I seem to navigate both. I've been a nurse, as Kathleen says, for over 20 years, because there have been many strong Black women who have paved the way before me. And if you know anything about nursing and healthcare, you know that many of the histories have been erased. And it's just recently, I know in nursing, that we've been trying to recapture what the place and space of Black women have been historically throughout. So you may have heard about Mary C. Cole in 1850, who was a Jamaican-born nurse, born in London, born in Jamaica, but was raised and based in London and England, and who cared for British soldiers. When you look at the history, Black women were not able to study in Canada. So many of them had to go to the US to get their nursing credentials. And so Mary Mahoney, you might have heard in 1879, was the first African-American to become a nurse. In 1945, Bernice Redmond was permitted to practice in Canada. but she had to get her diploma from the US. And then in 1948, the first Black woman, Ruth Bailey and Gwyneth Barton, were accepted into the Canadian nursing program in Halifax. So these are just a few of the pioneers or historians who opened the way so that I could be a nurse and so that I didn't have to go to another country to study to be a nurse. And so when I think about my role and what it is I'm supposed to be doing or why I do what I do, it's to carry on the legacies, to open the doors, to ensure that those who come behind me don't have the same struggles that I have. I'm doing my PhD in nursing, and when I listen to the stories of nurses across Canada, I hear the same struggles. They were the first. There were no other leaders, Black leaders in their area. The loneliness. But they shared with me that it's not about them, it's about us. And so the struggle is not for themselves, but it's to open up so that other Black women, male, female, however you identify, can come behind with less struggle, with less challenges, hopefully without the racism and the segregation that often is felt. So, when I think about my role, and I've been in many different roles in healthcare, and I moved from many different health authorities because I learned that if I wanted to move forward, I couldn't move forward in one organization. I had to start in one, develop, and then leave to find a new position somewhere else in order to move up. And that's sometimes a difficult thing to do, is to leave what you know, to seek out something else. And so how did I land in this place or space as leading the department for DEI here at PHSA? When 2020 hit and there was all of these changes, sorry, I just see a spotlight, sorry. When there were all these abilities and opportunities to start talking about equity and racism within the healthcare system, I knew that taking this job was one that would put a bit of a target on my back. And I also knew that it was one that wouldn't last forever. I always share that there's about a 4-year shelf life. I think I'm getting to the end of that, even if I include my maternity leaves in there or subtract them. But I took it knowing that this would hopefully open the doors for others behind me. It would ensure that hopefully I can make changes around systemic racism, barriers that people who are Black, Indigenous, people of color, people with accessibility challenges, be able to hopefully have more, let's say, get the care that they need. And so that's really why and how I landed here. I love my job. It's not an easy job, but it allows me to bring my clinical self, the scholar in me, the practitioner side, and all of that together to share what I see. And then also bring my embodied self, who Melissa is as a person of color, as a Black woman, as a mother, as a clinician, and as someone who cares. And so what else can I share with you? I think the only thing is my hope is that as we continue this great work at PHSA, that the minds and the doors open, that we start shifting the margins so that we are always questioning what voice is missing, what voice is necessary to be here, and to be bold and to be courageous when we ask questions. And my hope is that as we all engage in this dialogue today, that we listen deeply to the stories, to the experiences, and take that forward in a way that helps us move the organization forward, to help us ensure that each patient who enters the door can bring their full self um, to their experience, and that we believe them when they say, we need help and we need care. And so I will turn it back over to you, Kathleen, to kick us off and get us started. Thank you.
Thank you so much, Melissa. That was a wonderful way for us to start. And I know, unfortunately, you do have to step away, but we thank you so much for your time. And thank you for leading this work in our organization and really in the province. So thank you. So I'm going to turn it over now to my colleague, Stephanie Glick, and she will introduce herself and get us started with the panel.
Yeah, thank you, Kathleen, for getting us started. Thank you, Melissa, for getting us started in a very meaningful way. I loved what you said, that we're here to listen to these really important stories and to question the margins, push the margins, question realities, not realities, question whose voices are being heard and which voices need to be elevated. My name is Stephanie Glick. I'm a senior advisor of diversity, equity, and inclusion at Provincial Health. And I have a PhD in educational studies. I've been studying and working in anti-racism and anti-discrimination for decades. And I often include mindfulness practices in my anti-racism work because I find, and research finds, that it helps soothe nervous systems and it helps people be present in the moment, especially when they're hearing difficult information. And it can help them stay involved in the conversation rather than shutting down or resisting. I'm also a double settler of the United States and Canada. I'm the descendant of both Holocaust and pogroms survivors on one side of my family and enslavers in the southern United States on the other side of my family. And these very conflicting identities are what inform my drive for diversity, equity, inclusion, anti-racism, and peace, really. I have taught at the university level, at all kinds of social justice institutes, and I've developed and facilitated an arts-based meditation program for people who are living with and surviving cancer, as well as their caregivers. And I did that at a large hospital in the southern United States. I have also led a runaway and homeless youth shelter where I educated my staff on the social determinants of health. So all of this also comes in to inform what I do and my passion. So thank you all for being here today. And we did do things a little bit out of typical order because we needed to honor Melissa's time. So I'm actually just going to start where we would normally start and turn it over. We've got some slides to go over just to make sure we're all on the same page with some housekeeping issues. And then we'll get into, we'll introduce our speakers and start the panel. So Ama Nafisa, if you could please put up the slides, that would be great. Actually, I think we're going to go back a couple slides just for Yeah, just to let folks know that we've got live captioning. We've also got interpreters today. If you have questions or comments, please raise your virtual hand. You can also ask, and please be sure to ask questions slowly and audibly. That way our closed captions can pick up on it and everybody can hear you better. Please also feel free to post questions in the comments. We're going to have people moderating that. And again, we have ASL interpreters. Next slide, please. We'll be recording today's event. For folks who can't make it, we have a lot of people who, as you know, work on the front lines and they can't be here at specific times. So we want to make this as accessible as possible. And it will be posted on the DEI pod page and PSHA's YouTube page. So if you don't want to be seen, please feel free to turn off your camera. Next slide, please. So these are our fabulous panelists. And I'll just share a little bit about why we are bringing people together today, the significance of this, and then we will introduce our panelists. So I'm sure many of us have heard this, but plenty of us also haven't heard it, that in Canada, race and racism shape health outcomes for Black communities. And research shows that Black healthcare professionals improve care for everybody. And this is not just for people in Black communities, not just for Black people, but for everybody. So across roles, whether on the front lines, in research, or in administration, Black healthcare professionals are contributing in powerful ways through care that builds trust, through data that changes inequities, and through leadership that pushes institutions toward accountability. So as I said, research shows that representation itself improves care for Black communities and it strengthens the system for everyone. And this conversation invites our panelists to reflect on what brought them into healthcare, the experiences that have shaped them, the work that sustains them, and the changes they are helping to drive, while also challenging all of us to consider what responsibility we carry in creating meaningful and lasting change. We hope that one thing that we impress upon folks is that anti-racism and anti-discrimination is not simply the work of people who are experiencing racism and discrimination. It is all of our work. I would go so far as to say, especially those of us who have benefited from systems of oppression like myself. So I'd like to first start by introducing, or actually, Kathleen, I think you're doing the first introduction of Wendy.
Yes, thank you, Stephanie, and thanks for level setting on why we're all here. And we'll get started with introducing our esteemed guest to you. First of all, I would
let's
like
go to
to
Wendy. Sorry, we'll move out of the slide, Kathleen. I'm sorry about that, so that we can highlight our guests as we're speaking.
Okay,
So
yes,
I think
sure.
Amma was going to highlight Wendy as you introduce her. Sorry about that clunky transition.
No, thank you.
They're all highlighted and spotlighted, Stephanie.
Great.
Thank you.
Thank you.
Okay, thank you. Wendy, she is Chief Operating Officer of BC Centre for Disease Control, and currently serving as the Chief Operating Officer for the BC Centre for Disease Control in providing strategic leadership in public health operations, guiding initiatives that strengthen organizational resilience and community impact. And since 2013, Wendy has she's previously held the role of Director of Operations and Planning with BC Emergency Health Services, following nearly 6 years as the Fraser Area Operations Director, and has been recognized with the BC Healthcare Leaders Award for spearheading an initiative that reduced ambulance turnaround times at hospitals. Wendy holds a Master of Business Administration with a concentration in healthcare management and administration, as well as a Bachelor of Science in Business from Columbia Southern University. She is also currently a Doctor of Business Administration candidate. And that is all about Wendy.
We're going to do Tamar next.
Sorry about that. Tamar Austin is a doctoral student of interdisciplinary studies at the University of British Columbia. And she is a mixed methods researcher who utilizes community-based methods of inquiry, intersectionality, and Black feminist theory to understand how institutions and overarching systems stemming from a legacy of colonial and white supremacy shape experiences and access to care. Tamar's previous research has included the determinants of health and care experiences of Black women who use substances and aging Black populations living with HIV in Canada. She's currently a PhD candidate and CIHR Doctoral Award recipient, as well as a recipient of the President's Academic Excellence Initiative PhD Award and a 4-year fellowship award. Tamar's doctoral work focuses on obstetric violence, respectful care, Black perinatal experiences of obstetric racism, and their association with adverse pregnancy and birth outcomes. She has had the privilege of representing her work on an international scale.
Thank you. We have such impressive panelists. Okay. Tricia K. Williams is a registered clinical counselor. She is the owner and registered clinical counselor of Metamorphosis Counseling and Consultation. She is skilled in treating anxiety, trauma, transitional career, and relational issues. Tricia is an active community and social services professional who is a board member at New Hope Community Services. This is an organization for refugees who need transitional housing. Tricia K. is also a clinical counselor for Black Wellness at Simon Fraser University, and she's the host of the YouTube channel and the podcast called Meta Transitions that seeks to reduce the stigma of seeking help and champions diversity, equity, and inclusion for emerging adults navigating a life, career, and relational transition. Welcome, Tricia K. And last but not least, we have Ray Neal. Ray is a primary care paramedic with the British Columbia Emergency Health Services, where he has served for nearly 13 years. He began his career in the Okanagan, later working through the Sea to Sky corridor, including Lions Bay, Squamish, and Whistler, before securing his full-time posting in Vancouver. He now serves full-time in Richmond, British Columbia. And Ray was born in Trinidad. He immigrated to Canada with his family in 1992 after completing his A-levels. His diverse life experience and years on the front lines of emergency care have shaped his perspective on service and community. Ray is an avid reader who enjoys music, movies, and playing chess. He's grounded and enriched by his faith, family, and church community. He is married and lives in Richmond. Welcome, Ray. I think that our first question is actually to all the panelists, and we'll just take maybe a minute or two to answer however you like, of course. We're curious, why did you go into healthcare? What gaps did you see, if any, that you wanted to respond to? And this is to everybody, but if it's okay, maybe what I'll do is I'll start with somebody and then you can pass it along to each other. And I see right now we are featuring Ray, Tamar, and Tricia K. And hopefully we can also, there we go. We've got Wendy up there as well. Wonderful. Thank you. Tricia K., would it be okay if we start with you? And you can pass it on to the next person?
Hello, everyone. I'm so excited to be here. Thank you for having me. And so when I thought about this question, I thought about my own life experiences, as a student, actually as an immigrant student coming from the Caribbean. And I was in Canada maybe a year. And then I started university. And it was a really tough transition for me. Not only was sort of school tough, but it was sort of like an isolating place for me. And it took me a while to get used to that. and actually had to do counseling at school and, academic advising, which was actually quite a new concept for me coming from the Caribbean at that time. I don't know if that was a big thing at the time in the Caribbean. And so going and telling somebody else your problems, that wasn't a part of your family and you don't know them. And so it was a very vulnerable thing for me to do. And so when I reflected on this, I realized, going to that person was very helpful for me to be able to gain insight, to get skills, to talk about something that I was going through, and them giving me the tools to navigate that transition. And that's what I seek to do today in my own practice. I think that the gaps there are recognizing that there weren't a lot of people that looked like me that were counselors. And so, that was a big gap that I think I was filling at the time. Students, that were going to see counselors at that time, there were no Black counselors to see. And so I count it a privilege for the students that get to see me at Simon Fraser University. And as I'll share later, more stories about, those experiences. And so I think that's where I'll start for now.
Thank you, Trisha K. Why don't we go to Tamar?
Sure. Thank you for inviting me, and hello, everyone. Similar to Trisha's experience, when I looked at this question, I immediately kind of delved into not just my experiences, the experiences of women in my family. So, as you previously mentioned, I focused on pregnancy research, specifically looking at Black Canadian women and pregnant people's experiences of their perinatal period and accessing and using care. And just the stories within my family for the women who have given birth in Canada or their friends, there's always been this common theme of it wasn't an enjoyable process. Accessing care wasn't an enjoyable process. The way they were treated by healthcare providers wasn't an enjoyable process. So from early on, that kind of set up the idea in my mind that clearly something was amiss. I have family members who were told they weren't in labor and sent back home and giving birth at home, not on purpose. I have family members who were told that there's this expectation they would give their child up for adoption. But once I got to my master's and I realized I wanted to look at Black Canadian experiences of birth and pregnancy in Canada, and I'm dating myself here, this was about 8 years ago, there wasn't really anything there. There were a few studies. I think in the last 10 years, there's been an emergence of really great research. But when I want to do it, when I want to focus on it, there was just this huge gap. And we were pulling everything from the United States. And that's not to minimize the stories and experiences and similarities between Black Canadians and Black Americans, but there was nothing that really focused on the voices and experiences of Black Canadian women. And for me, that was, how are we really assessing and working on this problem when we don't know the scope of the problem? So once I got some experience within the field, that really pushed me into doing my PhD, focusing on this exact issue. And it's been a great opportunity just to look at how to assess this when Canada, and this is focused on later on in the panel, Canada doesn't collect race-based health data. And I think that really speaks to the resilience of the researchers in the field within Canada, that we're still able to produce this type of work when there's this massive missing gap that we could pull from to really assess the problem. So I guess this is the way I'm responding to the gap, by trying to push the field forward and really advocate for that collection of data.
Thank you so much. That you've both given us such great insights already. Let's turn it over to Wendy next.
Thank you so much, and thanks for those that have gone ahead of me. First of all, just really acknowledging everybody that's online, just flipping through pages and pages. It's so heartwarming, and I think this really speaks to PHSA and the culture that is here in this organization. And we don't take your presence for granted. It's truly amazing to have you all online today. So I'm grateful to be here today, and I think mine is simpler. I can say where I started and how I started and what kept me in healthcare. So I started growing up with the love of nurturing and caring and helping, and that's how I was raised. And just started my journey in healthcare in a little small St. John's ambulance like thing way over there, and that just really piqued my interest. And what kept me in healthcare was really through my journey. I came to realize really quickly that we're doing this backwards. Like, by the time you call an ambulance, it's too late. You never should need that ambulance. What are we doing upstream? What are we doing ahead of time to prevent the negative outcomes that we see and the inequity as well in the health outcomes that we see? And so I think for me, it was really looking at infrastructure, looking at systems, and that's my passion, in looking at the why and really going behind the scenes to figure out the why. Why is this happening? What can we do better before things actually become an emergency? And just being where I am in public health, it's so amazing, and working with incredible people, researchers, doctors, ops people. Like, it's great to see the work that goes in the back end, because public health is one of those systems that when you don't hear about public health, it's working. But when you do hear about public health is when things are really unhinged, really. So it's amazing to be part of a team that does a lot of the background work and really connect the dots for all of us, because at the end of the day, it's all one health. If your animals out there are not well, humans are not going to be well. Our environment's not going to be well. So how do we make sure that we're functioning as a system cohesively and walking gently on these lands that we're on as we do that work? So that's what's kept me. I love the back end stuff, and I still am excited about that. So thank you.
That's amazing. And I'm seeing so much weaving between the three of you so far. And I can't think of a better order to then move from Wendy to Ray, speaking about upstream needs to prevent the need for emergencies, basically. But the reality is we do have emergencies. So Ray, would you like to share a bit about your perspective and what brought you into the field? And you're muted at the moment.
Hello, good afternoon. Yeah, I'm humbled and privileged to be here. Thank you for the opportunity. And thank you for the previous panelists. It's wonderful to know that so much work is being done in the back end. While we get a peek behind the curtain, as I call it, as working as a paramedic, going into people's homes, seeing how they live, sometimes drawing on a lot of that social data that might not be obvious by simply, talking about an injury. And those are a lot of the things that we bring from that context. But often we don't know the rest of the story. We drop somebody off. We sometimes know what happens to them. We often don't. So to know that in the back end, there are people like Wendy, people researching, collecting data to hopefully in time influence change and reduce some of these inequities with Tamar's work and Trisha K. So it's good to know. So thank you. For myself, I got into paramedicine. Actually, it was not at all my plan. I had no intention of being a paramedic. My mom was a nurse, and I grew up obviously seeing her as a nurse. My mom's sister was a nurse. My mom trained as a nurse in Britain. My mom went back and forth to Britain. She trained nurses in the Caribbean. So seeing a Black woman as a nurse was not something that was alien to me. So I already had that perspective as a kid. Not that I wanted to be a paramedic, but I was living in North Van when my wife and I first got married and started our life. And a gentleman knocked on my door, and he was sick. He was having a heart attack. But at that point, I didn't know. I just said, "You don't look good." And he said, "I don't feel good." And I just drove him to the hospital. After about half an hour, because he quickly get an ECG and blood work was done, he was in an ambulance, and he went to St. Paul's, and he had emergency triple bypass surgery. And it just gave me pause. And I said, I didn't know anything, and I still kind of helped. So maybe I should learn something. And that's initially what piqued my interest to be a paramedic. My initial intent was just to go learn something, go to St. John's, learn some CPR, do something so you could, maybe at some point, if it came up, you'd have an opportunity to possibly make a difference in someone's life at a terrible time. And I just fell in love with it essentially. By the time I was doing EMR, I just really got into it and I thought, well, this is a path that I should explore. Initially, it was not easy because I did not know any paramedics. I didn't know anything about the service. I just thought you get a job and you get paid. And then I learned the harsh reality of being a paramedic when I started years ago. You're making $2 an hour on a pager, and you might make money when you go to work. So I had to have a job to fund my BC ambulance job for the first 3 years. I worked 14 days straight on an oil patch to make money as a medic, and then I worked as a paramedic for a week, and then I spent a week home. That was my life for the first 3.5 years. So thankfully, we've come a long way from that. They're now full-time paramedics. People can start working and making a living. So things have definitely moved forward, and a lot of that has to do with the alliance with PHSA as well, and having more impetus to get things done. But for myself, that was what led me to being a paramedic. What keeps me going is essentially, I've gotten to a point now where I just essentially look for, and this might sound a little cheesy, I literally look for the honor in serving. I think if you could find beauty in the mundane, in the things that people often overlook, that's where you'll really find your joy. So initially you come out with all these ideals. You want to change the world and help people. And then sometimes you find people who don't particularly seem like they want to be helped because you see them all the time. Or you see people who are aggressive to your ability, to your, desire to help them despite having called you. And all those different things that obviously become part of the job. So over time, you realize that your fulfillment has to almost come beyond the people that you see, although they are the reason that you come to work. So eventually, over the years, I got to this point where I've simply found honor in service. I try to treat people as I would treat them if they were my wife, my brother, my sister, my mom. I try to be present. I try to be respectful. I try to listen because, a lot of times that's a big part of the job is simply listening. I'm not a counselor. I'm not a a psychiatrist, etc. But I can simply listen. We can all do that, and we can all be present. So that's what keeps me going in my job: the ability to continue to serve others and to find honor in that service. That's honestly what keeps me going.
Thank you so much, Ray. Thank you, all of you. That I think really grounds us in what the conversation will be like today. So thank you for that background. And Kathleen, I think you've got the next couple of questions.
Thank you so much for that opening, everyone, and your perspectives and where you're coming from is just amazing. So our second question is about your experiences and what experiences have personally impacted you the most as a Black healthcare professional in your role. And I will start with Tamar.
So for myself, I am a researcher, and I think what's really impacted me in my role is, I guess, just the lack of representation of Black researchers, especially with academia. I say this fairly frequently. I've been in school a long time, and I've never had a Black teacher. I've never had a Black professor. I've never had the privilege of learning from anyone that looks like me. And I found often that meant that my research interests didn't align with the people I was learning from, or what I wanted to learn didn't align with what they were teaching. And I think that's more recently than ever really guided my intended trajectory for my future. I think when I first entered into my research program, I had different ideals with where I wanted to take my career, and that didn't necessarily include teaching. As I've moved through my program, I've realized that the opportunity or the ability to mentor the generation that comes after me in terms of research is something that's very important to me. So as I move forward, I definitely want to continue focusing on Black perinatal experiences. I definitely want to continue advocating for the collection of race-based data. And I definitely want to continue advocating for all the policy changes that can not only address the patient-provider experience, but the larger structural factors that influence race-based inequities in healthcare. But I think core to that is making sure there's a generation after me that continues on with this work, that whatever I don't get done over the course of my career, someone can carry on, can keep pushing forward, can keep continuing building the very foundations or expanding the field.
Excellent. Thank you so much. Trisha K., let's hear from you next.
Thank you, Tamar, for sharing that. I think that, impact in research is so important. And, I was thinking about when I was doing my own research for my master's, and I came upon similar experiences where I was having difficulty finding Black research out there specifically for my topic. And so I resonate with that a lot. When I thought about this question, I thought about more experiences I had with my clients. And I think the most meaningful is engagement outside of the session, which might sound weird, but I think because there are not a lot of Black people in BC, I think when clients see me out there in community, like because they're so comfortable, they will come up and they will embrace me. We'll have even more conversations outside of sessions. And I think that brings joy to me because, they're not afraid to come up. They're not afraid to embrace, and they're showing a sense of pride in me and the service I provide. And I think that is really important work, just to be present in a space. And also for a person to, show joy in seeing you as well. I also think about when students come into my office, not knowing that I'm a Black person, and them being a Black person and just being like really surprised that there's a Black counselor and be like, whoa. And, they either will be overjoyed or they will just start crying because they have a really big story that they have to share. And so that overwhelm in seeing somebody who they know is going to understand what they're going to share becomes, very, very overwhelming for them. And so those moments that I think about, that I think impacts me the most. I think the last thing I'll share is sort of the sense of the privilege in hearing the stories and being able to be empathetic to those stories in a way that they feel heard and seen is hugely impactful to me, because I think about, when I didn't have that and, being able to provide that service to them is very meaningful. And I see the change every day with clients. Just they sit back and they relax, and they talk, and they really feel welcomed. And I think that's the biggest impact I think I make every day with clients.
Thank you so much. I have witnessed that firsthand, and the work you do is very important. Wendy, would you like to
Yeah.
let us know what your experiences have shaped you?
No, this is good. I've just been reflecting, and thanks for those that have spoken. Very, very powerful, and thank you. So I think for me, again, I'll focus on my journey. That even growing up as a leader in the system has helped shape who I am today, and how I show up as well. So very earlier on in my career, after graduating, so my clinical background is actually radiology, and that was in the US. And so right after school, I was hired and I was told, like not even, hidden, that I was hired as a DI hire, like to balance out the numbers in a leadership role. So right after I graduated from radiology school. And so that was interesting to me. And I was very young at that point and didn't really think much of it. But as I was in that role, I decided, it really made up my mind to not just be that. I want to be a decision maker and I want to be a leader. And I also want to contribute to the decision making here because I can. And it took a lot of courage to do that. And I said, this is many years ago. Took a lot of courage. But I'd say the thing that was that I grappled with a lot was really being the exception all the time. So you walk into a room, you're the only Black person, like all the time. Like that was that burden through and through. And so I'd say fast forward to my role today as part of the executive leadership at BCCEC, I am still the only Black person, but I don't feel that way because I work with the most amazing human beings that see me as a leader and an important person as part of the team that we're in, and we work together to do the work that we've all committed to do as a team. And so I can say that's really powerful for me. I don't feel that being that lonely person anymore. I feel supported. I feel heard as part of my leadership. And then it's also important to be a part of an organization or a group that gets it. And when I say get it, is we're not shy to be uncomfortable. Like discomfort is the only way we get our work done. So these difficult conversations when we're talking about racial biases in our data, in our public health practices that we carry out every day, that's real. But that space I'm in allows me to have that conversation and not feel awkward and not feel strange. But that's the only way we can move things forward. So I can say the journey has really shaped in that way. And as we embark on our journey, even on ISAR and all the other things that we're doing, even within PHSA, it allows us to move from just a conversation to actually action that allows us to bring in more Black people into the organization as well through actual policy and practice versus just a conversation.
Excellent. Thank you so much. Ray, can you let us know some of experiences that stood out to you in your role?
First of all, I can echo some of what I was hearing, in terms of being, first of all, I'm not only Black, but a Black immigrant. So I came to Canada after finishing high school, went through uni and the rest of life and whatever else here in Canada as you're trying to figure out who you are, whether you fit in or not, as you go through this sort of interesting kind of dichotomy where you're no longer Trini, where I'm from, but you're not Canadian for sure. And that happened. So in the midst of all that, I think the thing that I think has been different for me is I did not know any other Black paramedics, nor did I really see any other. So it was pretty obvious that I was just gonna blaze my own trail in a manner of speaking. Not that I was doing it for Black people in the moment, but it's obvious that I was the only Black one. Over time, I've definitely met or heard of a few others. Last year, for the first time in my career, I had a shift with a fellow Black female paramedic, so that was quite unique. It's been a while before that may happen again, but that was gratifying. But for me, I think it's just important for us to be all of who we are in the spaces we dwell, if that makes sense. So for me, that's what it is. I grew up in the Caribbean. I live here now, but the flavor that I have is mine, and it's uniquely mine. So it's for me to share and sprinkle it everywhere I go. So that's essentially how I look at it. I haven't really experienced much racism myself. If anything, it's more sort of the cloaked, sort of old school, for want of a better term, maybe colonial type of racism, because I work in certain markets with a lot of elderly, wealthy, Caucasian people, and I've been referred to as colored, say, or different things in passing. Not that it's always been, the guy was 90 years old and he was from Rhodesia, he told me. So I am colored, if you follow. So there have been a lot of interesting things that may have happened throughout my career, but I can't say that I've overtly had any challenge. Specifically, and maybe different from a lot of my colleagues in working with First Nations and Indigenous people, if anything, see a kinship with me more than others that might work with them. In terms of their ability to work with me, I don't really experience any of that. So how it's informed, I think it's more a matter of ensuring that in your space that you represent, not that you're representing everyone, but in a manner you are. But I think it's more important to be who you are and to ensure that you're bringing your true essence to everything that we're doing. Lastly, just a little insight into the paramedicine field. There just isn't a lot of us because of the way that, at least my understanding, in terms of a lot of the things that feed paramedicine. Those who come from, say, water sports, lifeguarding, first aid, getting to paramedicine. There aren't a lot of blacks in that space, or people that do a lot of the snow sort of first aid and rescue and that kind of stuff. Again, not a lot of people in that space, and they in turn get into first aid and then become paramedics. So for me, when I was initially in Vancouver, I didn't see a lot of blacks, so it didn't seem wrong or odd not to see a lot in the service because I didn't really see much representation. But definitely over the years, I think we've all agreed there are a lot more black people here in Vancouver, be it of African descent or Caribbean descent, etc. But that essentially is all that I could see from my picture. Typically, where I work, I am the only black guy. But that's essentially how it works for me.
Thank you, Ray, and thank you for all of your comments on that question. I know with the long careers and so much experience you have, it might even be hard to pinpoint experiences to talk about. But thank you so much for recalling that for us and sharing with us. And so this next question is Frontline directed. And if probably Ray, you want to answer this one.
Sure.
Sorry, you just did a lot of talking there, but you might have
That's
to unmute again. And this question is, what is a frontline contribution that inspires you? And you talked a little bit of a part of this question about what keeps you going, but let us into a little bit about what inspires you.
Okay. Well, I think this began, when I say this, in terms of the way I look at things, began in my early 20s. I realized at some point when I was going through work and navigating career and that kind of stuff that work is consequential in that there is something that you want to bring to your work. So I thought it was important to develop what I call my work purpose. And my work purpose is I simply want to better the way people see themselves, their circumstances, and the world they live in through engagement, through this communication. So I used to do sales, business development for many years, and that's essentially what I did. I'm still doing the same thing, is how I see it. People are in the midst of a circumstance, a situation where sometimes they think it's the worst day of their lives, etc. And I'm there to, through communication, through my interaction, to bring a sense of hope, to bring a sense of calm, to better the situation. So years ago, I developed my work purpose, and it just so happens that paramedicine fits into my work purpose. So that's kind of how I did things globally. It wasn't, so it fit. So I think my entire life has to fit into my purpose. I think it's why I'm here. So it just so happens that paramedicine is essentially an extension to that. So the thing is, as I expressed earlier, it kind of morphs because in the start you have a very idealistic view, and then it can be beaten out of you, in a manner of speaking, being out there every day. You can, like I say, see the same people every day with the same circumstance, and things are getting no better. In fact, it's getting worse. Or in your mind, you think you're going to help people who really need you, and there are a lot of people calling who, for example, might have a flu and they want to go to the hospital. That's also part of the job. So as a consequence, over time, it morphs, right? So that's why for me, it was very important to focus on, let's say, that aspect of of service or ensuring that I'm feeding my purpose in the work that I do. So that's kind of what inspires me to go on, because I continue to look for new ways, for different ways, because like I say, it changes over time and it changes with the role, it changes with the market. The thing that I love as well is being able to have a cultural appreciation for things, because that's what happened. Like, I live and work in Richmond. We have a lot of Chinese, Asian complement of people out here. My Cantonese is much improved, but understanding how they go about, like in the Chinese healthcare system, as an example, generally nurses and doctors do only do the medically imperative stuff. So they don't come and bring you water. They won't get you a blanket. They won't, you know what I mean? So that's why culturally, when they're here, they're used to that. That's how it operates over there. So when they're at the hospitals here, they want everything because that's how they're used to taking care of their person at home. So understanding some of these things is also quite important in helping us determine how we go about providing that service. But I think ultimately, the last bit, sorry, is that with this job, you're going to pay a cost. I think, be it the nurse, be it, any frontline worker pays a cost for doing the job. So I think it's also important to ensure that, that's why it's important to have a purpose, to have things that feed you, to have things that fill your cup. And when you're outside of work, to ensure that you're enabled to continue working on that purpose. I think definitely I've paid my own price. I was off work for almost a year when a couple guys jumped on my moving ambulance in Vancouver. I was off for PTSD for a year and I was able to recover and come back. But I think a clear sense of that purpose and having the right community and people around you and having those things that are important outside of life, outside of work, are really the things that enable you to continue to do the job that you should do. And that's ultimately what keeps you going.
Thank you so much for sharing this dynamic experiences and everything that keeps you going. And I'll turn it over to Stephanie to continue with a couple other questions.
Yeah, thank you for your candid responses, everybody. This question is for Tamar, our researcher. And I'm actually going to combine a couple of questions for you because you started to answer them. You said that you want to make sure that a generation after you can carry on with your research. And I'm curious, how are you hoping to leverage and influence policy with your research? That's question number one. And question number two is, what do you want incoming generations of Black healthcare professionals to know, or Black researchers or people doing research on and with Black communities?
So to answer your first question about leveraging my research into policy change, I mentioned prior, I'm using nationwide survey data right now, and I really want to use my doctoral work or thesis as an opportunity to advocate for race-based health data. I think it's going to be a real integral role in terms of pushing the field forward. I know that there's been recommendations released to kind of advocate for that collection of data, looking at other countries that do that already, including the US and the UK. Beyond that, I'm also hoping that it pushes for career diversification in the healthcare provider workforce. There is some research out there stating that not only do Black healthcare providers increase infant mortality and outcomes for Black people, but they also do it for everyone. And similar to not really ever having a Black teacher or a professor, I haven't had the greatest opportunity of having Black healthcare providers. And it does make a difference when you go in, and we've had Trisha share this, it makes a difference when you go in and you see someone who looks like you. And with Black women, especially during the pregnancy period, which is one of the most vulnerable periods of your life, there's a sense of safety that you get from it. Even within Canada, Black women are saying, I'm really scared I'm going to die. And you have evidence saying, like, what helps this, what mitigates experiences of obstetric racism is having a provider that looks like you, that understands your experience, that doesn't come in with these racist perceptions of what Black women's bodies do and what they're capable of. I'm not sure if a lot of people know, but the entire field of obstetrics and gynecology was created and founded on the bodies of enslaved Black women. And the perception that Black women don't feel pain the same way comes from that. And it still persists throughout the field. And you see it in the way Black pain management is handled. So I think the diversification of the healthcare workforce, along with educational interventions for doctors, obstetricians specifically, nurses, to understand that the whole racial essentialism around what Black bodies are and are not capable of are founded in these racist stereotypes that for some reason continue to persist. I'm also really interested in the way that data is presented when it comes to race. I think it needs to be clear that when we're looking at race as a factor, what we're really trying to measure is racism. We're not saying that we're looking at race because these inequities in health come because Black bodies are different. And that's just it. We're more predisposed to these things. That's not what it is. And I really think any research that looks at race needs to be founded in the idea that we're seeing these differences because of structural racism, because of interpersonal racism between the provider and patient. And I think highlighting these issues and moving it forward and even presenting data, so we're not presenting these differences between Black health outcomes and white health outcomes, but rather Black health outcomes and what's happening at the population as a whole, or Black health outcomes and what the ideal outcome is really what's going to make a difference in the future. And sorry, what was your second question?
What do you want incoming generations of Black healthcare professionals to know?
I want them to know, beyond anything else, is that they belong there and they have the right to take up the space there. And despite what the assumptions are, Wendy's story about being told she was hired like as a DEI candidate, I want them to know that, no, you deserve to be here. That's why you're here. You're not here to fill a quota. The standards that have been set for your profession, you meet those and oftentimes surpass them. And I want them to know that the connections they make with one another is really what's going to keep them safe within their field. Because just like patients go into the healthcare system and face racism, I'm sure that Black healthcare providers face the same racism, and you might not get that promotion. Your knowledge base may be questioned in a way that people that don't look like you don't face those same questions.
Thank you. That's very powerful. I got chills listening to you. Thank you. I just want to do a time check. We have about 20 minutes left, and we were going to do Q&A for a certain amount of time. Was that about 15 minutes? Does that work? I can ask another question or two. Okay, that's what I'm going to do.
Yeah.
We had so many more questions for everybody, of course, but and we over prepare in case people aren't talkative or in case they're suddenly kind of shy, but you all have been so wonderful and creative and honest and vulnerable and insightful. So thank you. One thing that I really want to ask, there's so many things I want to ask, but well, let's see. What do people outside of Black communities need to understand to create meaningful change? And what responsibility do they carry in that work? So if we want a changed system, and Wendy talked a lot about systems, and Trisha Kay has talked about the importance of those systems playing out in these very specific spaces so that people who come into counseling, for example, feel seen, feel represented. And Tamar has talked about that as well, making sure that we've got teachers and doctors, physicians, everybody in medicine who look like Black patients. So what do we all need to be doing? Because as I said in the beginning of this program, this is not to fall on the shoulders of Black people. Anti-racism and anti-discrimination is the work of everyone. So what do we need to do?
I think I can go first.
Yeah, please.
Okay. And so I thought about this question, and the first thing that came to mind was, really acknowledging privilege, right? I think a lot of times, I think it's just cognitive dissonance. I think a lot of people just don't recognize the privilege that they have. And privilege is not just sort of racial, color privilege. It could just be privilege within a position as well, right? And so I think by acknowledging that privilege and being humble in a sense, you can create a lot of empathy and kindness for others, right? And I think that that's where allyship can then come in. The empathy and the kindness must come first before allyship can happen. The work can happen, where a person comes alongside you and can somewhat, have a bit of an understanding of, okay, I can see where I could potentially help this person get further along, or I can provide a little roadblock, for that person to get over that hump. And so that's what I thought about when I thought about that question, what a person might need to know. The first step is acknowledging your own privilege and then being able to show some kindness to somebody else.
Thank you. Good first steps. Wendy, how about you?
Oh, thank you. And thanks, Tricia, for really studying that in a meaningful way, that even as we stand here holding the positions we hold positions of privilege, every single one of us that's here. And we have the ability, or are sitting in positions that others may not even have the ability to have, or to be in. And so that's important. And I think for me, as I thought about this question, I was thinking about it from a public health perspective, and the structural components of what we're talking about here is like the racism is a public health issue. It's not just looking at it as something that's in isolation. This is something that impacts communities, impacts people disproportionately, and does lead to negative outcomes. And so for us, and for the team at BCCDC, we recognize that. And very recently we had an apology, and although Indigenous specific, and it's still Indigenous specific racism, which encompasses racism. It's the and, not the or. We acknowledge the harm that public health policies and practices still play today in shaping the negative outcomes of Indigenous communities and other communities, as well as other minorities as well. So it starts by acknowledging the truth, is what I would say. And it takes courage. It takes courage to step into that space. And it's easier when you have like minds, or you have people around you who have that commitment as well, to do good, because these are difficult conversations. They're very uncomfortable, and you really can frankly go anywhere. But it's, again, staying committed to making sure that we're doing what we're here for, and we're doing the best we can. And when we talk about allyship, this is a big system. There is no way any of us can walk it alone. And so how are we really leveraging the relationships we have, the partnerships we have, and respecting each other as we go along and do this work? And so from an administration perspective, I'd say in a leadership role, it's not the photo op anymore. It's not showing up. It's not me showing up here and walking away. It's also being accountable to the work that we're actually doing. The next time I should be able to come back here and say, this is what we've been able to accomplish as a leader in this organization, as a leader within the public health realm. These are the tangible things. These are the practices, policies that we've been able to change to be able to make way for others to come into the work that we do. And when we do that, it's one thing to change our hiring practices, but as a leader, have I made the space safe first before even doing that? Because it's one thing to invite people in, but what does that environment actually look like? So just really being in tune with where you are today, being in tune with the work that you're doing, and being real about that work. But most importantly, just really being courageous as you walk. And this is, again, not just us here. It's really work for a broader, more people than just us here. Thanks.
Thank you so much. How about you, Ray?
Yeah, I echo a lot of the previous sentiments, but I think it always comes down to two things. One, as they said, we have to be honest and you have to listen. I think that's essentially what it comes down to. So, first of all, we have to have an appreciation for people's lenses. People are who they are, having come from where they've come from, having seen what they've seen, having lived what they've lived. So a lot of that begins with, at least for me, when I'm working as a paramedic, I don't know these people, but in an instant, I have to make a connection, regardless of who they are, regardless of their age, regardless of the cultural upbringing. And I'll give a simple example. So just to illustrate my point, there's a story that was said of this lady who struggled going to see her mom because her mom had dementia and her mom no longer recognized who she was. So she felt like, why would I bother with this interaction when she doesn't even know I'm here? But simply put, if I raise a fist, that provides a certain response as opposed to my opening my arms for a hug, right? So all that to illustrate that people truly, I think, when your intentions are pure and honest, those things translate. So I think that when we approach these conversations with honesty, and being able to listen more importantly, because that's what allows people to express themselves, express the hurt, the angst, the pain, the vulnerability, etc. And that's what provides a backdrop for us to then be able to step into and have a conversation, for reconciliation, for change, for better systems, better management, whatever that might be. So that's essentially my perspective. It simply takes some honesty. It does take some listening. And as mentioned, it's sometimes an uncomfortable process, but a necessary process. So I hope it's something that we sort of step into, not just in our roles, but in our very lives as we go about our daily lives. It is something that we do. Yeah.
You're right. And last but not least, Tamar.
I feel like everyone really eloquently answered the question. But just really to add on to what everyone shared, I think it's really important that people interrogate their own biases, kind of understand what are your perceptions of different people from different communities. Where do they really come from? Is that what you truly believe or think, or is that what you've been trained by the larger society to think about these different communities? I think Wendy mentioned this as well. There needs to be a recognition of what the history of this country is. I always say Canada has very good PR at times, and a lot of the history within this country people aren't aware of. There are people that don't really know the depths of colonialism and residential schools. There are people that don't really know that Canada even had slavery. So when we're looking at the way those things have manifested today, you need to know where they came from. I also think it's really important that when you look around, you hold other people accountable. Maybe don't let that comment or that racist or biased behavior slip and not say anything because it makes you uncomfortable. You have to get comfortable in the uncomfortableness of calling out racism and discrimination. That's the only way anything is going to get moved forward.
Thank you so much for those succinct answers. We are going to move to our Q&A portion of the event. Does anybody care to speak? Unmute and speak. If not, I'll just go ahead and read a couple of these. See any hands raised? Okay, so a couple of you had mentioned being told or realizing that you were a DEI hire. What are some steps or approaches you took to demonstrate that you're more than a DEI quota? Or the equity voice in your health profession, and people see you as more than that. So what are the steps you took to show people that you're more than a DEI quota?
Since I broached that, I'm happy to start. So again, prefacing this, it was a long time ago. I was literally 19 years old, 20 years old, and this was also in Minneapolis. So just giving that for context. I think at that time, glamorous as was getting into a management role, after a while, like it was built in me. Like, is this what I want? And I'm like, no, I know I can do better. I know better. So it took courage. It took courage to show and demonstrate that I deserve this position and I am the right person for this position. I'm not here for your quota, because I know my abilities and I know I can do good work. So was commitment, it was dedication, it's a lot of work to get in there. But then it was also being surrounded by people who believed in what I was doing at the end of the day as well, you know? So it's those relationships, it's that allyship again. I keep going back to that, and the courage to be in that space, even when others think that you don't deserve to be there. But how you show up, what you show up, the work you put in, and being humble as well. Because again, being young and new, I didn't know all these things. I didn't know these financial numbers. I didn't know a lot of things, but it takes a lot of courage. And it is really bring us back to making up your mind to be strong, because it's going to be hard. It's going to be hard. And it's that showing up and being consistent that I think can help turn that trajectory. At least that's what it did for me. And with that, and with as time went by, and realizing the success that I had and the learning that I had along that journey, I think there was just no stopping from there. But it's my input.
Thank you so much. And I'm realizing I've stepped on Kathleen's toes, so I'm going to let Kathleen do the last question, and then I'll tie us up. But thank you. That's so refreshing to hear, Wendy, that you just kind of took ownership of it. You're like, I'm here because I know something, and I have some really powerful work to do.
There's a couple questions in the chat, but I'm just going to get to, there was one that just popped in, but I will honor order and ask a question that popped in there about 28 minutes ago. Are there moments, spaces, or conditions where you've seen systems become more flexible or responsive to change, or signs of institutional readiness? From your perspective, what tends to create those openings? How can those who want to practice allyship create or recognize these? Would like to take that question.
I just spoke, so I'll let someone else take it. Or I can jump in. Okay, because I like to talk. Okay, so what I can say is just hinging on our experience at PHSA, it's really leadership. It's leadership, and it starts at the top. And we've seen over the last few years the really mandate that has come down around our focus on even eradicating Indigenous specific racism, you know? And so it's the open space that the leadership table has created, the investment in the resources, and allowing the leadership team to learn and, you know, to go along this journey to understand the truth, to understand our part in this work as well, and then also holding accountability. So I think it's really hinged on the leadership, because I would say most of this staff that I know I interact with, or some of my teams, or even myself coming here as an immigrant, you're hardwired not to really speak up, because you speak up, you lose this privilege of being in this special place. And so how do you turn that around and not be disrespectful, but really understand you know, that, you know, why you're here, how you're here, and what your role is in the work that we have to do here today. And so I think leadership is important. I think in our roles, we model the behavior we want to see. We provide guidance. We issue direction on what the work needs to look like. And that is where I feel transformative change does start. But it's also the allyship that is in there, because these are spaces that are unknown to most of us, and how you navigate. It's not easy conversations. It's not easy decision making. So the more we partner, the more we create these communities of practice and people to lean on, because we don't have those answers. That is the way we progress the work and show up every day.
Thank you so much, Wendy. I'm going to sneak one last one in, and that is a frontline question. For those who have worked front lines in hospital or pre-hospital care, how do you navigate and create belonging while being out of place in both work, community, and community served? And I will ask our frontline representation here. Ray, how would you answer that question?
First of all, I mean, this might be a little odd to say, but I can't really say I feel out of place in any way, shape, or form. I'll give you like people like to say things like, "Oh, paramedics are heroes," and I don't see myself a hero. I chose a job. I was trained for it. This is what I decided to do. I was trained to do it on and execute it every day. So, just as nurses do or other people do. I mean, I think teachers are insane. I wouldn't know what to do with a room full of 30 kids, as an example. So I think we live where our propensities lie. Firstly, like that's part of it. So I think first of all, I don't feel like I don't belong. I think the more important thing is ensuring that when you're there, like I said, that you put your best foot forward. That as an extension, whether I want to or not, my being there, I am representing not just myself but Black people. As a consequence, not that it's always front of mind. What is front of mind for me is to do the best I can at all times for all people. That's what's front of mind for me. So as I go about my job, it's about providing that work ethic, having that true sense of care, also being honest with people, because a lot of people aren't used to honesty within healthcare. So something as simple as telling people, hey, when we get to the hospital, it's going to be 3-4 hours for blood work. And they're taken aback because they didn't know that, right? So that's usually when people lose their minds because they feel ignored. So a lot of it is tied to education. A lot of it is tied to that work ethic and doing the best that we can. And I think as a consequence, what it does is if I do my job correctly, it will be remembered for the right reasons, and it'll be seen by whoever needs to see it, be it those people I'm interacting with, be it those observing, or potentially going forward, maybe other young Black males and females might also want to be part of this job going forward. So in the moment, I don't think about the global picture, but because I have to be focused on what I'm doing, and that's a very intimate and personal decision in the moment, but I'm well aware that it has ripples, and I'm hopefully those ripples are positive ones.
Thank you so much. My son is going into the field, so I'm very excited for
Right
that.
on, bring it on. Give him my info. I'll be happy to chat with him.
Wonderful. Stephanie, did you want to close us out?
Yes. So a little reflection. First, a lot of gratitude. We have two frontline responders here. We've got Ray and we've got Trisha Kay, who are in the tangible weeds. And thank you both for what you do. Trisha Kay, I was so moved by hearing the responses that you get from Black students who walk into your office and learn that they can exhale. That's what I took away. They can just exhale first thing. Ray, thank you for being out in the field and for illuminating how dynamic that job is. I think that we are also very fortunate to be in this conversation with Wendy, who's making sure that systems run as well as they can, and that we are thinking proactively about systems, not reactively, and that we can get them to a better space. And I'm also so appreciative of Tamar, who is making sure that research in Canada changes and that we have greater accountability in numbers, and that it trickles into institutions, and that it trickles into the field of counseling and into emergency health. And I'm so struck by all of the tools that you've given us to walk away with. Those of us who are aspiring to be allies, we need to acknowledge privilege. We need to be humble and create empathy in our leadership. To be an ally is not just a day in the week, it's a lifetime. We've also heard you talk about how it's being accountable for change, not just saying that we're changing, not just having photo ops. It's also about being honest and listening and interrogating our own biases. And our team is just so grateful for you and for your time. And thank you, because this isn't just a professional commitment. The people that we're seeing today have had a lifelong investment in shifting systems and shifting hearts and shifting minds, because I don't have to tell you, you have lived experience, whether you signed up for that or not, you didn't. And that influences the work that you're doing and that we are all benefiting from. So thank you for that emotional labor and ongoing labor. And I'd also like to give special thanks. There are a lot of people who put this event together. Kathleen and I get to have our names at the forefront of it, but really special thanks to Nafisa, Ama, and Maureen, who make sure that everything runs as smoothly as it does. We'd also like to say Ramadan Mubarak for those who are acknowledging Ramadan. And I'd like to end with a statement for folks to think about. This is from Ruth King. It's her own personal meditation. She is a Black lesbian therapist, Buddhist, and she meditates on this phrase: may I be a light shining out in all directions for good. And so may we all be those lights. And a couple of us will stay on in case anybody has questions, but big, big thanks to our panelists.